Watson,
Yes, what is up?
something is amiss.
You mean that COVID-19 outbreak we have now?
Thanks for stating the obvious. Don't you find it bizarre that even the young ones are succumbing from the disease, even when they were completely healthy beforehand?
But that is what diseases do.
But did you know that there are reports of the cytokine storm syndrome that in COVID 19 patients can damage the patient's own lung?
Cytokine syndrome? You mean that villain we saw 15 years ago during the H5N1 outbreak?
Yeah,
What
that's the one. Here are the details that I have.
totally me.
Alexa,
Totally me.
play Despacito. Sorry, I mean the video.
Okay, Sherlock.
There, now hit it.
This criminal releases a flurry of cytokines, which are small proteins released by the immune system at the site of infection when the immune response is ineffective against a virus. They are known to attack those with autoimmune diseases, those undergoing cancer treatment, and viral infections such as influenza, and most recently, COVID-19. Evidence has suggested that those who become critically ill from COVID-19 is due to this perpetrator. It is known that around 10 to 15% of the human population has some subtle genetic mutations in their immune system that can create an uncontrolled immune response. People with these mutations have a higher risk of getting cytokine storm syndrome. Anyone could succumb to a cytokine storm, and that's why even young and healthy people are not spared. For infections such as influenza and COVID-19, the army of cytokines create mischief in the lungs as they attack their own tissue. They inflict damage such that the lungs become inflamed and dysfunctional. This causes the host to experience respiratory distress and, if they are not treated accordingly, death.
Viruses like COVID-19 attack the body by infecting cells and forcing them to create more viruses. Our body's immune cells build an army of cytokines, which are little molecules that trigger inflammation to fight the infection. The virus constantly infects new cells and vastly outnumbers our immune defense cells.
Around the survivors, a perimeter create.
Activated defense cells release more cytokines to divide rapidly and increase their numbers. The cytokines help bring cytotoxic cells into the infection site that release chemicals that kill the infected cells with the virus. Cells infected with the virus rush to warn neighboring cells to increase their defenses by releasing chemicals called interferons.
Commander, contact your troops. Tell them to move to the higher levels.
Very good, sir.
Usually this response is enough to kill the viral infection, but in the case of certain strong viruses like dengue and COVID-19, this may not be enough. The immune system ends up releasing too many cytokines in a desperate bid to stop the virus. But too much of something is not good. The inflammation that the virus creates becomes a super inflammation, and the cytotoxic cells that were only supposed to kill the infected cells end up killing normal cells too.
Wait, but what does this mean?
Well, this means that there will be a buildup of dead cells around the breathing membrane of the alveoli, the air sacs in our lungs. This inflammation also affects the areas around the infection, thus both heart and lung damage may occur.
The time has come. Execute Order 66.
Yes, my lord.
How will we actually know if someone is suffering from Cytokine Storm Syndrome? Essentially, Cytokine Storm Syndrome (CSS) are a group of disorders with varying inflammatory causes, and symptoms range from mild to fatal. Two major hallmarks of severe Cytokine Storm Syndrome are a very low blood pressure and increased blood clotting. The heart may not pump as well as it normally would, and as a result, cytokine storm will affect multiple organ systems. Besides inflammation, cytokine storm symptoms include chills, fever, fatigue, swelling of extremities, nausea, vomiting, confusion, hallucinations, rash, cough, short breathing, rapid breathing, difficulty coordinating movements, muscle aches, joint aches, headaches, seizures, tremors, poor responsiveness, enlarged spleen, excessive bleeding, low counts for all types of blood cells, and multiple organ failure.
That is a lot.
Detection. To prevent the full damage of this syndrome, it is important to detect a cytokine storm early. This can be done using the serum ferritin test. Ferritin is a blood protein that contains iron. Its levels increase during a cytokine storm, so this test could indicate if a patient has cytokine storm syndrome (CSS). Treatment definitely isn't straightforward. It requires bringing balance to the immune system. One needs to make it strong enough to fight off any infections, and yet tame enough such that it does not destroy itself. As of now, there's no specific treatments for CSS, and clinical trials are still ongoing for these treatments below. Glucocorticoids. Glucocorticoids are powerful general immunosuppressive agents. They can be used to suppress severe CSS consequences such as acute respiratory distress syndrome. They are inexpensive and readily available. The downside is that it might suppress the immune system too much such that it cannot fight off primary infections like COVID-19. As there are some significant detrimental effects to using it, it's sometimes controversial to use it. Selective cytokine blockade. Through this method, some biologic drugs block specific cytokines to reduce inflammation. Examples of these drugs are tocilizumab. Tocilizumab is a drug that blocks a cytokine called IL-6. A study has shown that some severe COVID-19 patients have improved clinically after receiving this drug in several doses. However, as IL-6 has an important role in the adaptive immune response, suppressing IL-6 may not allow a patient to fight off an infection effectively. Anakinra. Anakinra is used to block a cytokine called IL-1 beta. It seems to play a limited role in adaptive immunity, so inhibiting it seems okay. From various trials, it is found to be quite safe and effective to treat cytokine storms induced by autoimmune diseases. However, these biologic drugs are expensive and short in supply, so using these are not sustainable in the long run. Best treatment? There are not enough clinical trials to prove that these are effective for everyone. Therefore, there is no treatment that can be applied to all patients for CSS. Overall, the prognosis and recovery from CSS is poor, hence recognizing the condition promptly and using a combination of therapies could improve the survival rate of a patient.
What an incredible summary.
And what a crazy virus to cause such an autoimmune disaster.
Inconceivable.
Incomprehensible.
Stupendously quirky.